There's been a positive avalanche of reports, conferences, meetings, discussions about HIV and AIDS over the last week to 10 days. Allow me to enumerate. First, UNAIDS came out with its most recent omnibus report showing that for the first time ever, a majority of people who are living with HIV and AIDS are in treatment. Some 19.5 million out of 37 million in total. That was conveyed as a triumphant accomplishment, and indeed it is a very great accomplishment. But second, there were other aspects of the report which were not quite so triumphant. For example, 2 million new infections in 2016. That number has remained largely static over the last several years. 1 million people died. Only 43% of children in treatment, always a lower number for some inexplicable reason than adults. The opportunistic infection which kills most people living with HIV and AIDS is tuberculosis, 1 out of every 3. And we're not dealing with tuberculosis in any serious way whatsoever. There's galloping infection rates in Eastern Europe and Russia, particularly amongst key populations, defined as men having sex with men, sex workers, or injecting drug users, and even in East and Southern Africa, where we've made great progress. When you look at the numbers of new infections, hundreds of thousands, over a quarter of them are amongst adolescent girls. It again is inexplicable that we've never been able to break through on that front, no matter how repetitively we talk about it and document it. Third, at the Paris Scientific Conference on AIDS last week, Doctors Without Borders published a report on West and Central Africa, showing appalling levels of mortality and morbidity, people coming to hospitals with their immune systems lacerated and devastated. The drugs can't take hold, they die in hospital. We haven't done nearly enough in West and Central Africa. Fourth, the question of funding. The Kaiser Family Foundation did an analysis of funding showing that of the 14 major donors, 11 gave less in 2016 than they did in 2015, resulting in an overall drop of $500 million and the lowest total revenue contributing to the work against HIV and AIDS, the lowest since 2010. Fifth, unexpectedly, the World Health Organization published a report on resistance. Apparently, in a majority of countries they surveyed, over 10% of the people on antiretroviral drugs were showing resistance to certain strains of HIV. The drug resistance is really frightening, and it creates potentially insuperable problems for poor countries to deal with, both in terms of the drugs and the cost. And putting all of this together, it allowed Laurie Garrett, an internationally recognized global public health expert who wrote a book called The Coming Plague in the 1990s, which prophetically envisaged what was coming. It allowed her to write an article for Foreign Policy magazine on the next AIDS pandemic, an apocalyptic forecast of the future. The pandemic has been going for almost exactly 36 years. 76.1 million people infected, 35 million deaths. That's almost exactly equivalent to the entire population of my country, Canada. That was last week. I'm Stephen Lewis.